Hello guys, welcome to my YouTube channel. My name is Eberechi Ayogu. Welcome to Eberechi Ayog Health Tune, a channel that teaches you about infectious agents and the diseases they cause. Thank you for watching my videos. Thank you for subscribing to my YouTube channel. And if you have not subscribed, please, and you come across this video or any of my videos, please do well to subscribe. By doing so, you are helping me to grow and you are learning about your health. Today I want to talk about one important, it's not important because it's a disease, but I want to talk about this infection that people think, for example, where I am in Nigeria, once someone is having this infection, people's mind will be that this person has been poisoned and it is only the charm that can cause this disease. That's the belief in the area where I am. I don't know how they see people that are suffering this disease in your place. The stigmatization is very, very high, and this disease, by me looking at the person, is too scary. So what am I talking about? Today I want to talk about an infection called elephantiasis. Elephantiasis or lymphatic filariasis is a tropical disease. The infection occurs when a filaria parasite transmits this filaria to human through the mosquito bite. So infection is usually acquired at early childhood, and the person will carry it, and the infection will be hidden and be damaging the lymphatic system. So as the child is growing, at a certain stage, like 15 years later, this infection will turn into a painful and disfiguring manifestation of the disease. This occurs later in the person's life. This manifestation may be lymphoedema, which is the swelling, the big swelling on the person's body, like on the person's leg, or the scrotal swelling. So because of this swelling on the leg, the kind of the swelling that will appear on this person's leg, people are always stigmatizing them and maybe running away from them, and this causes poverty and hardship for them, because when they are even selling in the market, nobody buys. When they touch something, people will run away from them. The infection is very, very scary. When you see someone that is suffering this infection, you say, I don't want to go close to this person, because some people thought that you can even get it immediately you even talk to the person or look at the things if you are already infected. So I don't know how people that are suffering this infection in your area are feeling, but where I am, people stigmatize them very, very well, that they live in isolation and abject poverty. So the causes and transmission of this infection? Lymphatic filariasis is caused by infection with parasites classified as the nematode, which is roundworm. It's a worm that causes this infection. So there are three types of this roundworm that causes this filariasis. One is called Wuchereria bancrofti, which causes 90% of this infection. The another one is Brugia malai, and another one is Brugia timori. Two of them also contribute in causing elephantiasis. So this adult worm lives in the lymphatic vessels in a human body, and this parasite disrupts the normal function of the lymphatic system when it is living inside the lymphatic vessel. It is, lymphatic system is part of our immune system, so it gives response to the infection. So but this filariasis lives inside the lymph vessels, so and when it lives there, it starts damaging the lymphatic system. So the worm now can live there for over a decade, and it will be start producing many millions of microfilaria that will now start circulating on the blood. So in the blood, the microfilaria will start circulating on the blood. Then when a mosquito bites the infected person, this mosquito will now take up this microfilaria. By sucking the blood, the mosquito will now take the microfilaria into itself. So this microfilaria will now grow into effective, a microfilaria will grow into effective larvae. So the larvae now, when the mosquito bites uninfected person, it will deposit this microfilaria that has grown into effective larvae on the person's skin, and this larvae will now enter into through the pores on the hairs on our body. The hairs on our body, our skin has pores, so this larvae will enter into our body again and enter into the lymphatic system and grow into adult worm again. That's how the cycle starts all over again. So this is how people get this dangerous and scary infection that will now start swelling their legs or their scrotum, or even at times it affects women's breasts. So this is how it is being transmitted. Nobody is giving it as a part of, as a poison, and maybe you match poison somewhere. It is transmitted by a mosquito from infected person. So the mosquito that involve in this type of transmission: coolest mosquito, which we see in urban and semi-urban area; anopheles, that we see in the rural area; and Aedes mosquito, mainly in endemic area. So the symptoms at times is, the people that are infected at times are asymptomatic, they don't show any symptom, but the infection is inside their lymphatic vessel, damaging things inside their body. So some of them are acute, that the infection is immediate. When they have it, you see that they are suffering it. You are seeing the symptoms, you are seeing everything. So this involve the skin, the lymph node, the lymphatic vessel. It will now, everything will be infected, and that is when the person will start growing that heavy leg, and the person's leg will be swollen and have rough skin that look like elephant. That's why it is called elephantiasis. So some of them are still chronic on the tissue or in the limbs. So it can involve the genital, the breast, like I said, and it can deform the person that is involved, that is infected. It can give the person disability forever, because it is not easy to cure. The best thing to do is to prevent it. How do they prevent it? Worm drug, to prevent all this worm, because the treatment of this, when it occurs, may be very difficult. So if you see bendazole, you collect it, you take it. Worm drug supposed to be taken every 3 months. You deworm yourself to avoid all this, because this infection is very, very, very dangerous because of the stigmatization that is in it. You wouldn't want to go and collect food or anything, or even what anybody is selling, that someone that is suffering from this kind of infection, you wouldn't want to collect things from the person. And what we think, especially where we are, where the part of the world I am, they think that whenever someone is suffering it, somebody has given it to him. There is a charm, there is poison, this, that is what people think. But it is not so. It is ordinary worm that is causing it. And if we keep ourselves neat and avoid places that we meet all these mosquitoes, I think we will not get this dangerous infection. Thank you for watching my video. Thank you for subscribing. God bless you. Thank you.